What is borderline personality disorder? Today we will look at borderline personality disorder. What if your girlfriend or boyfriend has this tendency? It can be very hard. People with borderline personality disorder have very high emotional ups and downs, and they have unstable relationships. Mood swings can be intense as well as rapid, such as sudden shifts to anger or sadness. At one moment, they might feel close to a loved one. At the next moment, they might feel disgusted by that person. They lack the ability to regulate emotions appropriately and have difficulty controlling anger. If you say, "I want to break up with you," they can't control their emotion, and intense anger comes, leading to very destructive or violent behaviors. People with borderline personality disorder can also misunderstand the reactions of others. For instance, they might think a person who likes them actually hates them. They have difficulty controlling anger. Along with intense mood swings comes intense anger, seemingly out of nowhere. Slight inconveniences or slights can trigger rages in those with BPD, potentially leading to destructive or violent behaviors. They feel emptiness. They often experience chronic feelings of emptiness. They will engage in all sorts of activities to try and fill the void without any effect. Regardless of how many friends and loved ones they have, they often feel alone and sad. They become paranoid and are afraid of being alone or rejected, causing intense paranoia. That can cause them to act obsessive and constantly seek reassurance. Unfortunately, many of the behaviors which result from a need for reassurance can lead people to push someone with BPD further away. People with borderline personality disorder often think about suicide. Roughly 1 in 10 people with the disorder actually kill themselves. For this reason, it's very important that people with borderline personality disorder be treated by a professional who has experience with the disorder. They can have problems with risk-taking. For example, they sometimes take illegal drugs or have unsafe sex, and they can be violent with themselves or others. They also have trouble thinking clearly or logically when overcome by emotion. They can have many mental problems too. For example, they might have depression, anxiety, or eating disorders, or they might abuse drugs or alcohol. Is there a test for borderline personality disorder? No, there is no test. But a mental health expert, such as a psychologist or psychiatrist, should be able to tell if you have it by learning about your symptoms, your relationships, and your experiences. How is borderline personality disorder treated? The main treatment for borderline personality disorder is psychotherapy. There are different types of psychotherapy that can help. In general, they all focus on helping you learn new ways of thinking and behaving so that you have less extreme mood changes and feel more at ease. Many people with borderline personality disorder also benefit from medicines to help with mood changes, anger, and other symptoms.